Hi.
Hello.
Thank you so much for speaking with us. Could you please introduce yourself for us, please?
Sure. My name is Marina and I'm a first year medical student.
Okay, great. And the first question we have for you is, what got you initially interested in medicine?
Sure. A lot of things got me initially interested in medicine, but if I have to reflect back to, the catalyzing moment, or as the seed that, as we call it, it was when I was in middle school. My father got a heart attack. I remember that day, I was sitting in class, and my mom came and pulled me. Like, I was pulled out of class, and it never happened before. Like, I was one of these students that never had to go home early or anything like that. So when that happened, I was very, very surprised. I didn't really know what was going on until we reached the hospital. I was very confused. By the time we got to the hospital, my father was already rolled for surgeries. We just weren't sure if he's going to make it or not, and that was a chance for me to, if anything were to be happened, that was a time for us to be saying our goodbyes. But fortunately, that did not happen, and I'm glad he's still alive. He's doing well now. But at the time, he had a coronary artery, like a 90% occlusion, and he wasn't getting enough blood all over his body, and it was just like a very close call. But the surgeon who took the surgery and took him under his wings did really well and helped him recover afterwards. Beyond my father and how well he did, I remember how us as a family unit, we were just like confused. We had a lot of questions. We weren't sure about anything. But right after the surgery, before like even the surgeon like took a break or anything like that, he came to us, talked to us, sat us down, explained everything, literally answered every single question we had, like also about the aftercare and like recovery and all that. And I felt like that component of medicine, that humane part, that's just taking care of the whole family, is something that I really wanted to do. Not just like help people get better, but also help their families, help their friends, and just help them getting on that road of recovery. So that was like a very, very forming moment in my eyes. At the time, I was still like middle school, very young, didn't see that many female physicians around me in Egypt, let alone surgeons. I don't think that is a very common thing. Maybe now it's more common. But for me, that was like a very exciting thing. Like, let's think about science, let's think about medicine. And I just like had it in the back of my head till I want to say 10 years later, immigrated to the United States. And I started thinking about it more robustly. I saw more female physicians. I was like, maybe that's the chance to go back and think about how I can do it. And I started volunteering, shadowing, and every time I helped the family with something small, even like answer a question where like, where's the doctor? Or something very simple like that, helped. It just felt very rewarding, very right to me. And that's when I decided that medicine is just the right career for me. Also the fact that I really enjoy education, and I love working in the community, especially when it comes to prevention programs. I felt like medicine is one of these careers that really combines all my passions in one place, so I could be a physician, a clinician, but also be a community leader, help the community feel better and get better. We don't have to wait till a disease progresses. We can prevent things early on, and that's really the goal, especially when it comes to very simple interventions. That is really my goal with medicine. And education is one of these tools, again, that if people knew about screening, about other things, it would have prevented a lot of consequences later on. And just that's how I feel like, or I view medicine in my eyes, is just taking care of the whole community, taking care of the whole patient. But yeah.
If you could please describe the type of physician that you would want to see.
Sure. I think I might have already seen that type of physician before. Again, not only the surgeon that took care of my father, but here I had an amazing mentor during my first year of medical school. And every time I went to shadow that physician, I saw that more than just being a physician, they were the patient's friends and advocates. So they always ask about how their day is going, how is their life outside their disease or their illness or their condition, which a lot of times I think we often forget to ask patients that. So that's the type of physician I'd like to see, someone who really cares, kind and genuine, outside of what just brought you in the office today or in the clinic or in the hospital, but also the physician who wants to know more about your life, more about how this has been impacting your whole life, and not just, that aspect of the disease that you're often presenting with. I think that's the type of physician I like. I also have seen a lot of advocacy on the behalf of the patients. Sometimes the patients are vulnerable and they don't know what they can get or what they can't get. And I've seen a lot of times where that physician was able to literally move through rocks and mountains just to ask if that patient can get an extra week off of work, or if they can get daycare for their kid, or they could get some aspect of social help that we don't normally think about, more than just like the medications or the prescription, but also how can they sustain that. I've seen a lot of incidents where families had hard time coming here, again just because of how far they live, but they did really need to see the care and seek the care here. And I've seen how much work goes into literally organizing transportation, calling there's like a transportation company that is with social work that you can access. And I didn't know all these things, but I've seen that physician sit down and go through these calls, make all these connections just for the patient can come here and see them. So I think that's the type of physician I want to see. I also aspire to be one day, just really getting to know my patients, getting to know all the limitations, all the complications that prevents them from seeing me or seeing anyone else. But that's it, yeah.
So the next thing we would like to ask is if there are any thoughts or comments that you would like to share in the video.
I guess so. I think it's just more of a general comment about me being or wanting to be a physician. I think that looks different to every person, and that what makes this specialty a really beautiful one to pursue. A lot of people have their different reasons, but there is there's a common theme here that everyone is here to help someone or make someone feel better. And something that we often forget in medicine is a lot of times we won't have the answers, and it's going to be okay to say I don't know, but you are going to be able to help the family get through it or make the family feel better. And I think that is a very distinguishing factor between a really good physician who cares and a physician who just didn't have the answers at the time. I think more than just saying I don't know, it would be really great to be like, I don't know, but I can walk this family through what they're going through and just help them feel better given the circumstances. And I think this is a very hard thing to learn as a medical student, but also as a future physician, is the fact that a lot of times I won't have the answers, but all I can do is help the family get through it at that point. And I think all the people I've talked to through so far in medicine have that common theme of like, yeah, they're not scared of this. And it's just like a learning moment for me. And I feel like I just wanted to share that in the video.
Is there any life advice for viewers that you would like to leave us with?
Sure. One of the things, personally, like just going through life, and I learned that, is to give yourself some grace. Just like whatever you're pursuing, the route is going to be long, the journey is going to be long. Sometimes it's going to be hard, you're going to have a lot of downs. But giving yourself some grace through it all, or like celebrating the little successes along the way, is what really makes it worth it. And it just like fills you up. And again, you cannot pour from an empty cup. And I feel like just giving yourself grace along the way really shows whatever your passion is or whatever career you're going into. I feel like that's very important, just to take care of yourself so you can be the best version out there for others as well.
What was it like growing up in Egypt?
Ooh, I loved growing up in Egypt. I think that was, I had a beautiful childhood, large family, a lot of cousins and relatives, and I think beyond just the immediate family, a lot of friends. We have this thing in Egypt where like we live in these apartment complexes and everyone is your neighbor and we get to play with everyone's kids. So I literally have friends everywhere I went. So it felt like, it just felt home, felt right. So I had a very nice childhood, and it was very unfortunate when it was time to leave. I think one of the things we don't forget is how much you appreciate it, the love, the family. And I think that's one of the things I miss right now, is just having all this, social, I want to say like it's a very strong social bond that no matter how hard you work, it's very hard to replicate. But it's also beautiful because I had that and I know how that felt like. And hopefully like in the future, it is something that I worked through. Like that's why I really enjoy working in communities with people. It just like gives me the same sense of home, where everyone is there and everyone is here for the same reason. We're all here together. despite our differences and our own ideas. So it was very nice growing up in Egypt. So I loved growing up in Egypt. Yeah. Sorry.
Okay, so the next question we have is, how is your father doing now?
He's doing better. He's alive, thank God. A lot of he's on a lot of medication, a lot of follow-up visits as expected, but he's doing a lot better. And just the fact that he's giving a second chance at life is something I value and appreciate a lot. So I'm thankful for that. Yeah.
We all know that the path to becoming a doctor can be filled with so many moments in training where we are expected to have a lot of answers or to know a lot of things and questions. So, in your opinion, how do you think we can kind of undo the habit of having to know all the time or becoming okay with the unknown, from exam questions to, more importantly, patient connections and interactions?
Sure. That's a very well thought question. It is something that I always also reflect on a lot. Whether I'm studying or preparing for an exam where I know that I'm going into that exam not expected, actually having this expectation of not knowing everything releases some of the stress because you are not expected to know everything. Even on an exam or on a board questions, these things are written in a way where you're just expected to either know a certain amount and pass or know enough to be able to help a patient. And that's what really is helpful in knowing. Just like starting by knowing your own limitations as well is something that helped me, because I know in a lot of times, even when it comes to patient interactions, I won't have the answers myself. But not knowing now doesn't mean I won't be able to go back and research or go back and ask someone else who might know the answer. It's better than just saying I know and I try to give an answer and it's not wrong. Like it's false. It's a false answer just for my own sake of not looking bad in front of a patient or on a board exam or whatever the time is. I feel like it's better to say I don't know now, but what I could do is it's either I'm going to research or follow up on that, or I'm going to call a colleague who knows a lot more about this than I do. And just like knowing that limitation and knowing that you also have a lot of resources. You're never working in isolation in medicine. So if you as a human being are expected to have all the answers, then we don't need so many physicians. But I think the beauty of medicine is we work in teams. Someone would know more than you do in an area. That does not make you a worse physician. It just makes you acknowledge and ask others for help, and they'll do the same with you. So just having this idea in mind that medicine is a team sport and it's never expected of you to have all the answers is one of the things. Also, the fact that we know now how to do research, how to ask questions is a tool that we could help our patients with. Be like, yeah, I don't know the answer, but I could read more upon it and get back to you as soon as I get, if it's not like an emergency situation. Other things I think about is even on an exam, if there's a question or topic where I screwed up on, it's time for me to go back and reflect to be like, hey, like I need to know this better. I need to study this. So this is a chance for us to improve and know, like, okay, I did not know it. I didn't even know that. So it's just the fact of not knowing, but now you know, helps you get better and helps you work on that area of weakness of yours. And it's a growth mindset where we're not expected to know it all right now. It's just you grow and you know more by experience, by seeing more patients, because there are times where you're not going to see a disease or an illness many times or in textbooks, but you're going to see it for the first time with the patient. And in that area, you just have to have this growth mindset where, like, yeah, I might not have the answers, but I'll be able to at least help this patient, walk this patient through even the emotional aspect of it before giving the answers, before prescribing drugs, before doing all these procedures. So not knowing is a process that we have to get comfortable with, I think. And I think it's more of a personal, like I don't think anyone is going to teach you, oh yeah, it's fine. I think it's more of a personal effort to grow more comfortable in that and just seek help and acknowledge that you don't know whenever it's possible. I think people view it as a weakness of saying I don't know or I need help. But for me, it's a lot of strength and it requires a lot of work to be able to say that.
I really appreciate all of your amazing answers and taking the time to speak with us.
Oh.
This has been a really amazing experience for all of us.
Thank you. I enjoyed speaking with you guys.